pleasure this morning to introduce Dr. David Kovacic. Dr. Kovacic is managing partner of Indiana Heart Physicians. It's part of the Franciscan Hospital Group. And he's the medical director of their disease management clinic. David joined Indiana Heart Physicians in 1994 and is board certified in internal medicine, cardiovascular disease, echocardiography, and nuclear cardiology. David, from a cardiologist's point of view, what are the dangers of untreated sleep apnea?
There are many dangers of untreated sleep apnea. The ones that are most prevalent in cardiology is increased incidence of atrial fibrillation and increased incidence of heart failure, both left-sided and right-sided, and really refractory hypertension, blood pressure that we just can't control with the standard medications. There's other complications aside from those, but those three make up a large volume of the population we see in our office every day.
Do you think that snoring is particularly a problem, or is it just, like most people think, just a nuisance?
Even snoring has been associated with premature vascular disease in the absence of sleep apnea. So snoring by itself is actually an independent risk factor for vascular disease.
What prompted you to get tested for sleep apnea?
My wife actually prompted me to get tested for sleep apnea. I've snored for years. It got worse as I gained weight. And finally she noticed that at nighttime sometimes not was I snoring, but I would snort myself awake or cough myself awake or stop breathing for a period of time, and that prompted me to be evaluated.
Continuous positive airway pressure is the traditional treatment for sleep apnea. What were some of the difficulties that you've had using it?
I did try the C-PAP first, and I had two major difficulties. One is that after wearing it for about 3 or 4 hours, I felt like I was being smothered and just had to take the mask off. The other issue I have is I do move around a little bit when I sleep, and when I would do that, I'd actually pull the mask off just a fraction of an inch. That would cause an air leak, and that would wake me up.
Now, the American Academy of Sleep Medicine recommends that oral appliance therapy as a first choice of treatment for mild to moderate sleep apnea, and for those who cannot tolerate or who are not appropriate candidates for C-PAP. I'm curious, how did you find out about oral appliance therapy?
Well, after I failed my C-PAP, I talked to my pulmonologist, and he actually referred me directly to you. So I really did not have much knowledge about oral appliances up until that point.
I've worn many of the different styles of oral appliances, and my personal choice is the Snoring appliance because it's comfortable, it's strong, and it's a great company behind it. David, could you tell us maybe just a little bit about what your personal experience has been with your oral appliance, the Snoring?
Sure. Really, it's like a bulky retainer. And so I had braces when I was a kid, and it's not much different than that. It basically is something that after a period of a couple weeks you get used to. And it's a couple weeks because during that time you actually kind of adjust it to bring my bottom jaw forward. But really after a couple weeks you don't even notice it's in there. And if it weren't for an adjustment period, it would be more like a couple days. So it's easy to wear, it's something that's easy to take care of. To this point it's been very durable and it's been effective.
Thank you. What was the process of, like you said, getting it fitted and getting used to it? That wasn't too difficult?
No, it was surprisingly easy, and your staff here made it easy for me to get it fitted correctly. Whenever I had questions, I could call in and get an answer quickly, so it all worked out very well.
How has it improved the quality of your life?
It's improved the quality of my life in a couple ways. Probably the most important way is that I don't have to hear my wife every morning complain about the fact that she couldn't sleep because I was snoring next to her. But I have better quality sleep. I'm not as sleepy during the day. I really didn't have blood pressure problems, so I don't know if it's really had any effect on that. But overall quality of life, I feel better, my wife's sleeping better, and I know that down the road it's going to help reduce my risk of cardiovascular complications.
So I guess if your wife was here, would she be happy, or what would she have to say?
Yeah, I should give it an A+.
She'd give it an A+. She's not a teacher.
No, she's not. She's still giving it.
So how would you compare the oral appliance to the C-PAP?
For me, it's the oral appliance has been very easy to use. It's something I haven't missed a single night of. I never made it through an entire night with CPAP. I tried 3 different masks. The people worked with me, they were great. I just couldn't do it. So it's night and day.
Encouragement would you have for doctors that might not be aware of custom design oral appliances, or they may have heard these rumors that they don't work?
I think you just give it a shot. I think that if you have patients who are motivated to seek treatment, patients that either weren't a candidate for C-PAP or tried C-PAP and failed, I think that you give it a shot. And you give it a shot the right way, have the right people who have experience with the products, work with the patient one-on-one. It's like everything else in medicine. I think if you individualize to the patient, you'll get the best results.
Was there any particular reason why you chose us or any dental sleep? I guess it was on referral.
I was
from your pulmonologist.
referred here based on your reputation. Absolutely.
Any words of wisdom for someone who's hesitant to try an oral appliance?
I think there's very little to lose and lots to gain. I think that if you're to the point where you're talking about using an appliance, you've already been diagnosed as having sleep apnea or excessive snoring issues. And again, those are risk factors for problems down the road. So I think that when you look at something that has basically no risk, it just takes a little bit of your time to get it made and fitted to you. There's very little to lose, lots to gain.
Well, it's been a pleasure helping you. Is there any candid comments you'd like to make? Or
I think that people are unaware of the risk of sleep apnea and excessive snoring, and I think people are to some degree unaware of all the tools we have available to us to help those patients, and they need to look into it. It's a big problem.
Thank you.
My pleasure.
You bet. It's been a pleasure.